Hi, my name is Fred Rotnick, and I'm Program Director of the Addiction Medicine Fellowship at St. Louis University. Today, I'd like to spend a few minutes with you to talk about alcohol use and self-assessment for medical trainees. And this is part of the School of Medicine wellness community. The US has a complicated relationship with alcohol. From the 2019 National Survey on Drug Use and Health, the self-reported survey that's been going on for decades, we can see the prevalence of drinking of the US population in general, 18 years and older, on the left-hand side of the page, which goes from drinking at some point in one's life to drinking in the past month, to the prevalence of binge drinking, typically reported as 6 drinks or more in a single setting. And binge drinking is typically reported out to be about 25, almost 26% of people 18 years and older have engaged in binge drinking at some point in the last month. Now let's take a look at what these type of questions look like for college students in the US. And this cohort is roughly ages 18 to 22. This slide lists some differences among college students versus non-college students in the same age group. And you'll notice that college students have a higher prevalence of not only drinking, but a higher prevalence of binge drinking. 1/3 of college students report binge drinking within the last month. These numbers are from the National Institute for Alcoholism and Alcohol Abuse, part of the NIH. Consequences for college students with binge drinking or risky alcohol use include academic fallout, poor performance in classes, health problems, particularly mental illness and sleep issues that can result due to alcohol use, or alcohol use can be used to provide comfort from serious mental illness. Of particular concern are acute risk among college students, which include impaired driving, risky or unsafe sexual behaviors, fights, suicide attempts, and also possibility of overdose and death, particularly if somebody is using other drugs while they are drinking alcohol. Next, let's take a look at the correlation between burnout and alcohol abuse and dependence among US medical students. These numbers also are pretty remarkable. For over 1,200 students were surveyed, and they got responses back from over 35%, which is pretty impressive. Of these, 1/3 of the students met diagnostic criteria for alcohol use or dependence. There was a strong correlation among alcohol use disorder with those students who reported themselves being burned out or depressed, or reported low mental health or emotionally quality of life. Also, there was a strong association with emotional exhaustion and depersonalization. Not surprisingly, there was also correlation of heavy alcohol use with students having burnout and having student debt, being unmarried, and being younger. I have the resources at this end of this presentation. Let's also take a look at after medical school, residency, training, and fellowship around substance use disorders in American physicians in general. Again, a broad survey of over 25,000 physicians, over a quarter completed these surveys. And in these situations among practicing physicians, about 13% of male physicians and 21% of female physicians met diagnostic criteria for alcohol abuse or dependence. Alcohol tends to be the substance of choice for both male and female physicians, and abuse of prescription drugs and use of illicit drugs was rare. Factors that tended to be associated with alcohol abuse or dependence were age, hours worked, male gender, being married or partnered, having children, and being in any specialty other than internal medicine. Specialty choice, however, was strongly associated with alcohol use or dependence. And then also alcohol abuse or dependence was associated with increased burnout, increased depression, suicidal thoughts, lower quality of life, lower career satisfaction, and recent medical errors. So we're seeing a trend, college students, medical students, practicing physicians. We're seeing high correlations of substance use disorder, particularly alcohol use disorder in all of these populations. So we might want to take a serious look about what can be our response to this and how can we help ourselves as a profession. What I call the elephant in the room on this topic, though, is not a diagnosis of a substance use disorder or alcohol use disorder. What we really want to take a look at, which is much, much more common, is problematic drinking. Problematic drinking is risky for our profession in medicine and healthcare in general because we drink for a lot of reasons. We tend to drink to celebrate, to be more social. We tend to drink because our friends and peers are doing it. We also drink to relieve discomfort. Whether that discomfort is something as serious as a mental illness or just occasional anxiety or loneliness. We also drink to forget personal problems, and some of us drink because we simply enjoy the feeling of being intoxicated. This is not unique to medicine. There's also a very high drinking rate in professions such as law and in other professions such as construction and many of the labor professions. We know the long-term effects of alcohol use and risky use. We've learned that in medical school, but what are some of the short-term effects of problematic drinking? Things that might affect us on a day-to-day basis. Many people with risky or problematic drinking do not fit criteria for alcohol use disorder. However, the risky or problematic drinking can cause other problems in a person's life. And those problems can range from simply questions of concern from family and friends on your state of well-being and how you're doing. It can cause strains in relationships at home with your loved ones, with your partners, with those you're dating. It can cause problems at work, showing up to work late, showing up to work under the influence, missing work because of problems associated with heavy weekend drinking. And of course, it can also cause financial problems, particularly during training when our salaries are not that great. But we can self-assess our drinking behaviors. We don't need to wait until there is a full-blown problem to get some help and get some interventions. And quite simply, to just sit down and think about what are our drinking patterns and are our drinking patterns causing us problems in our life and in our work. There are many ways we can change our drinking habits. And as I mentioned, we don't have to wait till something terrible happens for us to do so. We have many tools, and all of these tools are at St. Louis University through our wellness resources in the School of Medicine, which are available on the graduate medical education page. Those include mutual support groups. Some of these groups are well known, such as 12-step programs, including AA, including Smart Recovery. There are groups that are specifically geared towards physicians and other healthcare providers so that there is confidentiality and freedom to speak with particular problems we may have in our professions. There's also availability of counseling and other psychotherapy, again, through our resources at St. Louis U that are free to medical trainees and medical students. There are medications which can help us if we have an alcohol use disorder, if we want to take advantage of the medications that can help our brains calm down, help our neurotransmitters regulate, and most importantly, help us control our cravings and protect us against risky use. And then a promising fourth category are digital therapeutics, new tools that are being developed that we can access via the internet, on a smartphone, a tablet, a laptop, a PC, that allow us to do some work on our own to help us build resilience and also help us to, first of all, to think critically about how is my drinking? Am I satisfied with my drinking behaviors? Do I want to set some goals to change some of those behaviors? These are all things that digital therapeutics can help with. On this slide, I have links to our wellness resources at St. Louis U School of Medicine, and also in terms of the medication interventions possible for drinking, our Department of Family Medicine provides treatment for risky alcohol use and alcohol use disorder. Something I'd like to introduce today, though, is a new resource called Vorvita. This is a digital therapeutic developed by Orexo, and we have been offered at St. Louis U a free digital trial for our medical students and medical trainees. And the purpose of Vorvita is an opportunity for the user to assess his or her own alcohol use and to decide whether or not they're happy with their alcohol use or if they'd like to set goals and to modify their alcohol use. It's not meant for somebody who has developed serious problems already, as much as it's meant to take a look at what are my habits and am I comfortable with those habits. Vorvita combines cognitive behavioral therapy with other techniques that helps the user of the therapeutic to identify triggers, to break negative behaviors, and develop healthier responses to triggers that may cause an individual to drink in risky or unhealthy ways. It's been shown already to create more self-awareness among people who use the therapeutic and drink less alcohol in as little as 3 months. Some of the interesting aspects of Vorvita is that it includes motivational interviewing, goal setting, self-monitoring of symptoms with questionnaires, cognitive and behavioral strategies for handling alcohol cues, cravings, and risky situations. If you'd like to find out more about Vorvita, take a look at its website. We are creating a login at St. Louis U that you can access this therapeutic anonymously and use it for 6 months. See if you like it. Take a look at the questions it asks, and what we ask of you in response is to complete a pre and post survey on the ease and attractiveness of its use. Here are the references to the journal articles I used earlier. I'd like you to consider using Vorvita if you'd like to take a look at your alcohol use and you'd like to consider making some changes in order to promote your health and well-being during your training as a physician at St. Louis U. Thank you very much.